All right, so welcome everyone. For those who don't know me or haven't seen me before, my name is Christina Clark O'Karmas. I use she, her pronouns. I am the executive director at the Alabama Campaign for Adolescent Sexual Health. This is our monthly webinar series that we like to do on the second Tuesday of every month. This month we adjusted a little bit for our speakers, so I'm just going to popcorn over to Megan, who is on staff with the Alabama campaign now as well.
Hi everyone, my name's Megan. I use she, her pronouns, and I just joined the Alabama campaign as the outreach coordinator. So I'm really excited to be here and meet all of you and excited to listen in on this session. I'll probably be dropping a few links to our website and our new Instagram account and some upcoming events as the session sort of concludes. And then at the end, I'll add on an evaluation for the webinar. So thanks for being here.
Perfect. Thanks, Megan. And I am so excited. Well, let me tell you a little bit about the Alabama campaign first, for anyone who doesn't know. The Alabama campaign is a 501c3 nonprofit existing we work in Montgomery and Tuscaloosa now, so that's exciting. We do work statewide on the issue of comprehensive sex education. So we are looking to advance that in all ways possible across the state. We primarily do that through trainings of adult participants. So folks like y'all who are working with young people in some capacity. And we do a lot of advocacy and outreach, resource distribution. And we're going to be really busy in February and March, just tabling at a lot of events, talking at a lot of events. So you may see us out and about at an event local to you. I hope if you do, you'll come and say hi. I have the honor of introducing our speaker for today, Annerieke Smaak. Is that how you pronounce your last name, Annerieke?
Yep.
Okay. Daniel, Annerieke Smaak Daniel is a researcher at the Women's Rights Division of Human Rights Watch, and her work focuses on sexual and reproductive health and rights and the impact of structural racism, discrimination, and inequality on women's health outcomes in the U.S. We did ask Annerieke to come in today to talk to us specifically about cervical cancer and HPV vaccine because she did some research, I guess, back in 2019 before the pandemic here in Alabama about the link between cervical cancer deaths and access to comprehensive sex ed. And they produced a great, Human Rights Watch with Anneriek's lead, produced a great report on that, which I'll send the link over in just a moment. So she's going to talk to us today about kind of all these topics and how they coalesce and are intertwined. So with that, I'm going to pass it over to Annerieke.
Thank you, Christina. Hi, everyone. It's really nice to be here today. My name is Annerieke Smaak Daniel. My pronouns are she, her. And as Christina mentioned, I work in the Women's Rights Division at Human Rights Watch. Human Rights Watch is an international non-governmental organization. We're based in New York, but we work in 100 countries across the world, and we investigate and report on human rights abuses. So we do a lot of in-depth research. We use those findings, we produce reports, so we do advocacy to really push for changes to policies, laws, and practices to address the human rights abuses and violations that we have found. So we do work here in the US. I'm based in Washington, DC, and my work focuses primarily in the US and specifically working in the South. And so Human Rights Watch, we see cervical cancer deaths as a human rights failure. You know, we see them as an issue of poverty, inequality, racism, and discrimination. As I'm sure so many of you know, cervical cancer is highly preventable, it's highly treatable. If caught early, the 5-year survival rate is over 90%. So really, we shouldn't be seeing cervical cancer deaths in the US. We have the tools to prevent them. We have the HPV vaccine. We know with regular screenings, the pap test, HPV tests, timely follow-up, early treatment, we know how to prevent the disease. But unfortunately, we're continuing to see too many people die from cervical cancer. And approximately 4,300 women each year die from cervical cancer in the US. And so Human Rights Watch has looked at this issue specifically, looking at racial disparities in cervical cancer mortality rates. So Black women die at the highest rate of cervical cancer in the entire country out of all racial or ethnic groups. Black women are more likely to be diagnosed at a later stage when the disease is harder to treat. Black women have lower survival rates for all stages of diagnosis. So whether they're diagnosed early or late, Black women are more likely to die compared to white women. And then Black women are also less likely to receive aggressive and adequate treatment for cervical cancer. So there are treatment differences that also contribute to the racial disparities that we see. So we first approached this issue in Alabama in 2018. We produced a report. It was researched and written by a previous fellow named Kelly Flannery. And Kelly's research focused specifically on the Black Belt counties of Alabama and really exploring barriers preventing Black women from accessing comprehensive cervical cancer care. So at the time that report came out in 2018, Alabama actually had the highest rate of cervical cancer deaths in the entire country. And at that time, Black women were almost twice as likely to die of cervical cancer than white women in Alabama. So that's why we specifically focused on Alabama for that research. So I'm going to take a pause and play a video. So this video came out when that report was produced in 2018. It's a short 5-minute video, and then I can talk a bit more about the findings from that research. So I'm going to quickly share my screen. And just if you could let me know, if you can give me a thumbs up to let me know if you can hear the video when I start playing it.
Oh. We can see your screen, so that's a good start.
Yes.
My mother was notified that she did have precancerous cervical cells. She served in the U.S. Army. Unfortunately, she was not able to get any cancer care from the VA because of my father's income. My father made too much money for the VA. My father made too much money for Medicaid, but he did not make enough money to pay for the surgery.
Nearly 4,200 women in the United States this year alone will die from cervical cancer. In Alabama, the rate of cervical cancer deaths is higher than in any other state. Black women are twice as likely as white women to die from cervical cancer in Alabama.
My mom held on until she turned 65 and got her Medicare benefits. About this time, it was too late.
Some of the barriers to access to care for women, particularly in Alabama, are access to consistent coverage for insurance. Also, there just aren't enough doctors in rural Alabama. And because there aren't enough doctors, transportation to the health system becomes a significant barrier.
It is sad to say that in 2018, that a woman that's diagnosed with cervical cancer would have the same transportation issues, would have the same healthcare provider issues that my mother faced in 1980.
Ms. Frances Ford is a tireless advocate for rural hospitals, particularly in her county, Perry County. She also lost her mother to cervical cancer 30 years ago.
The quicker we can get in medical attention, then it means you have better outcomes and things just work out better. We do not have an OBGYN in Perry County, and so it's not possible to receive specialized care.
If you can't get that initial care, and then you compound that with, well, what if it does come back as cancer, and then you can't get the treatment on time? You're basically telling me that I might die from something that was preventable? That doesn't make sense to me in the United States, the richest country in the world.
Up until a couple of months ago, Dr. Stevens was the only OBGYN in a 5-county area.
Some of our patients will drive 2 hours. I mean, they can't get here. And a lot of times that's money, pure money. You catch these things in their precancerous stages and they're a breeze to take care of.
I took pictures. I wanted to remember that.
When she got sick, it was just unbelievable. I even talked to my doctor about it, getting her help. First thing he asked me about her insurance. I said, well, we're not worried about insurance. He said, something wrong with my wife. He said, well, in other words, he just turned it down.
If my mom was able to have Medicaid, I believe that we're preventative precancerous cells from growing and turn into a tumor, all this could have been avoided. I think that by her not having health care, that it kind of like a death sentence.
When she passed away in her funeral, I gave the eulogy. I wanted everybody to know about my mother and her legacy that she left. I was a college band director, and the only way I knew to do it was the way I speak every day through my band. Everybody should have a dream. I really feel that way. These are people's lives we're dealing with. Like, I don't have a mom right now.
I know people that have two incomes, go to work every day, and don't have insurance because they cannot afford insurance. And they have to make a decision. Am I going to pay my bills? Am I going to pay for daycare for my child? Or am I going to pay for insurance? And sometimes people have to make decisions. And sometimes you have to think about right now. The health priorities that Black women face are definitely linked to the economic challenges. Black women make 61 cents on a dollar in comparison to white men. I mean, you can open up the floodgates in terms of how economics can be related to structural racism.
As a Black woman, I feel like a lot of times my issues may be ignored. Sometimes Black women are seen as a little bit more difficult. And then just because sometimes we don't seek care as early, and a lot of it has to do with us having bad experiences with the doctor.
There is structural racism and provider bias in the system. People don't realize when you're not important to the government, there's a family there. There are kids, there's a spouse.
Cervical cancer deaths shouldn't happen in the United States. This is a preventable form of cancer, 93% survival rate if we catch it early. Lawmakers in Alabama can step up, expand Medicaid coverage to more people, and really take steps that will save the lives of the women that live in their state.
Yeah, so that video, sorry, let me just exit out of here quickly. Yeah, so that video came out with the report launch, and I think it touched on quite a few topics that we found in the research. So I'll go over a few of the barriers. So lack of access to affordable and consistent health insurance was a huge one. So many women who were interviewed just talked about how they couldn't afford cervical cancer care. Women talked about having to make difficult choices between paying for groceries or paying their utility bill or going to see the doctor. And that's just heartbreaking. These are times where people are foregoing cervical cancer screenings, they're postponing them. Even, if they get an abnormal test result, some women might just not go back because they can't afford it, especially if it's that follow-up specialist care that they need. So really not having access to health insurance that's affordable, that's consistent, that's comprehensive is a huge barrier to cervical cancer care. And then transportation. Lack of gynecologists in the Black Belt. At the time that report came out, there were only 4 practicing gynecologists in all of the 17 counties in the Black Belt. So you can imagine how far some women lived from gynecological care. So, finding someone to take them to appointments, to wait with them, to drive them home, paying for gas, taking time off of work, arranging childcare, these are all barriers when the doctor might take an entire day to go to and from. So really it's hard for women who live in these rural areas without medical care to see gynecologists. And then mistrust of the healthcare system. I know Dr. Murphy spoke about that, arising from negative experiences, callous treatment, experiences where women felt like their health concerns were undermined or dismissed because of providers' bias against them as Black women. And then also the impact of structural racism, the exploitation and abuse of Black people, considering, we're in the Black Belt where the Tuskegee syphilis study happened not too long ago. These are generational traumas that are passed down. Women who we interviewed were still talking about it, how in their families, they're advised not to go see a doctor, or, we can't trust doctors. And this is arising from our history in this country of structural racism. So even if a woman could go to the doctor, say it was right around the corner and she had great health insurance, that might be a barrier for her even to go. So that was another one. And then a lack of information on sexual and reproductive health. This was something that we heard repeatedly in Alabama in follow-up research that we did recently in Georgia, which I'll talk about in a little bit. But just not having information on steps that they could take to lower the risk of HPV or prevent cervical cancer. So, so many people who we spoke with had never heard of the HPV vaccine, did not know that it was a cancer prevention tool, didn't know that it was for everybody, didn't know that it was approved for women up until the age of 45, Pap tests, HPV tests, when to get them, what to do if you had follow-up or abnormal test results. These were just not information that people had in their communities. And the other thing that we heard repeatedly was, not talking about sexual health sexual health and reproductive health. It creates this stigma around it, like this shame, like people don't want to talk about it. It's a taboo subject. So people just aren't talking about it, maybe not discussing their health concerns with medical providers, not talking to their family members, not talking to their friends. So this just fosters misinformation, people who just don't understand cervical cancer. We heard from women who said, I don't want to go get a Pap test because if it comes back, abnormal, I have cancer. And that's not the case. If they had information, they could understand that cervical cancer is highly preventable, that, if they caught any precancerous changes early, it's highly treatable. But, not having that information, not knowing that it takes typically 10 to 15 years for cervical cancer to progress and develop, it's just another barrier preventing people from actually going to get the care that they need and timely care that could save their lives. So these were all barriers that we found in Alabama. And so really looking at the situation, looking at the women who we interviewed, the Black belt communities, our research points to clear patterns of racism, discrimination, neglect, and exclusion. And really the fact that Black women living in the Black belt counties aren't able to access the information and the services that they need and have a right to in order to prevent cervical cancer deaths. So we called on the Alabama state government to do quite a few things, but overall, the expansion of Medicaid, ensuring that more low-income women have access to health insurance so they can go get their Pap tests, their HPV tests, that they're not afraid of the medical bill that they might receive or the fact that they can't afford it. That's really important. Ensuring equitable, comprehensive, and accessible gynecological care in rural communities was another one. So really addressing many of the barriers that we found around a lack of just gynecological care that's available in rural communities, including, transportation challenges like we talked about. And then comprehensive sexual health education in Alabama schools. That is, key to ensuring that everybody has information on their bodies and health so they can make safer and informed decisions as they grow up, and that they can prevent, cervical cancer, that they can understand the role that HPV plays in causing cancer, how the HPV vaccination works, all of this information that just they'd be better informed, more likely to take steps to prevent cervical cancer. We really felt like sexual health education in schools is the key. So that report came out in 2018. And then in 2020, we published a follow-up report, and that report focused specifically on sexual health education and the HPV vaccine. And it was a follow-up to, like I just mentioned, one of our key findings from the cervical cancer report, that just so few people had information on their sexual and reproductive health. And we really saw this as such a missed opportunity for Alabama to take a concrete step to ensure that all people had this information. It just seems like so, simple. Like you're in a state with high rates of cervical cancer deaths, high rates of cancers caused by HPVs, high rates of STIs. Why wouldn't you want to take steps to make sure that young people have this information, that they're informed? And so we really saw that again as a missed opportunity. So for that report, we interviewed 113 people, and this also included 45 young people between the ages of 18 to, I think, 26. Actually, I'm sorry, I think it was 16 to 26, but they were from 16 counties across Alabama, and they shared their experiences around sexual health education with me. So I led that research and I published the report. And yeah, so I will actually now flip to another video. This one is shorter, but this one also came out when the report was released in July of 2020. And then we could talk a bit more about our findings from this project. So let me share my screen again and play this video.
I'm from Newmarket, Alabama, and I went to a public school called Buckhorn. There was abstinence education, so there was no sex ed at all. I was told that if I had sex before marriage, you were a cup of water, and whenever you have sex with a boy, he spits in it. And who else would want to drink that cup of water?
So I'm from Lowndes County, a small rural town in the Black Belt. My first exposure to sexual health was sexual health class. At the beginning, we like signed these virginity pledges, and then we just started doing homework.
Everything I knew about sex, I learned from the internet, the back of the bus, and like watching trash TV.
In Alabama, schools are not required to provide sexual health education, and if they do teach it, the state code requires a focus on abstinence.
We need sex education in school because children, regardless of what they do, they need to have the education necessary to be able to make the decisions that's going to impact their life.
That is the role of a school. A school is supposed to like educate and prepare kids, and I do think they deserve to be given as much information as possible to make the right decisions for themselves. I wish that more young people understood like what an STI is and how it affects the body and like how exactly it's spread.
Alabama has high rates of sexually transmitted infections, or STIs. One STI, the human papillomavirus, or HPV, leads to several types of cancer, including cervical cancer. Alabama has one of the highest rates of cervical cancer deaths in the U.S., and Black women there are nearly twice as likely to die from the disease as white women. Cervical cancer is highly preventable. The HPV vaccine is an effective cancer prevention tool and protects against most of the strains of HPV that can lead to cancer. Yet in Alabama, vaccination rates are low. Without access to information, young people lack the knowledge to decrease the risk of cervical cancer and safeguard their health.
I feel like a lot of people see the HPV vaccine as something that's going to make like girls promiscuous. So they kind of like shun away from that. I know sometimes when I do like outreach events and we talk about HPV vaccinations, and then girls, they're like really confused, like what is that?
Vaccines are good. They help prevent disease, and good cases can help prevent cancer. So we need to market that on a level to parents and children within the school community, within churches.
I'm so big on prevention. If we can teach people how to prevent, if we can teach you to get the HPV vaccination, if we can teach you to get those PAPs on time, maybe I can prevent you from getting cancer.
Yeah, so I mean, that research really sticks with me. Almost every single one of the 45 young people who I spoke with received abstinence-based education in schools, and the comments that I heard, like that it was just based on fear, and creating shame and stigma. I heard that it was ineffective. I heard that young people, they got to college and they had no idea about their bodies. Like they couldn't believe information that their peers from other states knew. Harmful metaphors, like were discussed in the video about spitting into a cup of water, just all of this information that wasn't meant to educate and inform young people, but instead meant to shame them and really scare them into not having sex. And it was just really harmful. The title of that report is actually called "It Wasn't Really Safety, It Was Shame." And that's how one young person who I spoke with described sexual health education that they received in high school. And I mean, again, this isn't doing anything to help them stay safe, to help them make informed decisions. So many young people I spoke with did not have accurate information on their sexual and reproductive health. They didn't even know where they could go for resources. Like young people didn't even know till they were out of college that there were resources available in their counties that could help them stay safe. And the other finding from that report, the other main finding was around the HPV vaccine. Again, with Alabama having low rates of HPV vaccinations, we found that the state wasn't taking steps to really address these barriers and ensure that everyone has information and access to the HPV vaccine. Young people weren't learning about the HPV vaccine in schools. Parents didn't have information. They weren't getting this information from schools. Oftentimes, medical providers weren't recommending the vaccine, especially in the same way that they would recommend other adolescent vaccines. There was a lot of misinformation around the vaccine, stigma as a vaccine that prevents sexually transmitted infection instead of, this vaccine that prevents cancer for everybody. And also, parents just not understanding what the vaccine does, that it protects both boys and girls, that it's important for everyone to get. Just a lot of information that people just did not have, important life-saving information. The state wasn't really doing anything to address this. And so some of our key recommendations from that report is for Alabama to mandate comprehensive, rights-based, inclusive, medically accurate, age-appropriate sexual health education in all Alabama schools. And then also to take steps to ensure that information around the HPV vaccine was available, not only to young people in schools, but also to parents and guardians, again, who just didn't have this information. We talked to so many parents, of adolescent age students who did not ever hear about the vaccine, did not know it prevents cancer, wish they had this information, went out and vaccinated their kids as soon as they had this information. So there's so much more that the state can be doing to ensure that everyone at least has access to this information and understands that it prevents cancer. So those were the two reports. That report actually came out in July of 2020, and the other report came out in November of 2018. And so, we have Human Rights Watch, we produce these in-depth reports, but a lot of what we do is advocacy, really taking our findings to lawmakers, like sharing the stories that we've heard, sharing our testimonies, like really trying to push for changes to policies, to laws, to practices, to address the findings and to improve health outcomes and human rights abuses. And so it was hard with the pandemic to really do the advocacy. It was, July of 2020 when this report came out. I actually was in Alabama in early March of 2020 to film the video. And it was right when the pandemic happened. It was scary, everything shut down. And then I didn't travel for 2 years. So it was really hard to do the advocacy from afar. So I'm really excited about a current project that we're doing in Alabama. So we just started. We launched this project over the summer. And so we're working with 6 advocates who are based in 6 of the Black Belt counties. So Marengo County, Sumter, Lowndes, Wilcox, Bullock, and Greene County. And these are women who are from the counties, who have deep relationship, deep ties to the county, and are passionate about health equity. And so we onboarded them and we trained them around cervical cancer prevention and sexual health education. And now they are serving as a resource in their communities. So they are out there, they've created materials, they have talking points, they're having events. So they're hosting events, they're attending events, they're just really out there sharing the word in their communities around cervical cancer prevention and the HPV vaccine. And they're going to be doing advocacy, talking to local lawmakers, to state lawmakers, to really share findings around the research, their own experiences, and really ensure that this information is available to everyone. So it's really exciting. It's great. The reason, we're focused on the communities is because we want communities who are impacted by these human rights violations to be the ones who are leading the work. This is their lives. This is their lived experiences. I live in DC. I can come visit Alabama, but I come home. So it's really important that community members are the ones who are at the front, that they have the resources, the tools, the information that they need to lead advocacy, to lead education, not only around cervical cancer prevention, but health equity in general. So it's really exciting to see this taking shape. I was actually in Alabama last week, and we had a luncheon in Lowndes County, a luncheon in Wilcox County, and a focus group dinner in Lowndes County. Wilcox was the luncheon, the dinner was in Lowndes. And I actually see someone on the line, Miss Linda Hayes, who was in Wilcox for the luncheon. It was really cool to see Miss Hayes there, and to see what the advocates are doing, the conversations, the fact that Linda Finklia, who is our lead advocate in Wilcox County, was able to bring 22 women to the table for a lunch discussion around cervical cancer prevention for Cervical Cancer Awareness Month. And many of these women hadn't heard about the HPV vaccine. They were given information, they were given info.
Your parents are here.
And they left, fired up, excited. People were already texting their grandkids, their children, to make sure that their family members were vaccinated and knew about the vaccine. So it's really important to invest in communities, and I think it's really exciting. And just to say, so things have gotten better in Alabama. Alabama no longer has the highest rate of cervical cancer deaths, but rates are still very high, and Black women continue to die at high rates. They're more than 1.5 times as likely to die of cervical cancer as white women in Alabama. And mortality rates are high in the Black Belt counties, and Black women who are living in rural counties in Alabama continue to have the highest cervical cancer death rates in the entire state. So yeah, so we're excited about that. And then this is a different state, but I think it's also very exciting to talk about. So after we wrapped up the report in 2020 on sexual health education and HPV, Human Rights Watch partnered with the Southern Rural Black Women's Initiative for Economic and Social Justice. And they work in Mississippi, in the Delta of Mississippi, and the Alabama and Georgia Black Belt. And we worked on a community-based participatory research project. So together we onboarded, trained 9 community-based researchers who worked in 3 counties in Georgia. So it was Baker, Coffee, and Wilcox counties. So there were 3 researchers per counties. And they were actually the ones who led research around cervical cancer in their communities. So it's very similar to what we did in Alabama. It was research to really try and understand barriers that are driving racial disparities in cervical cancer rates in Georgia. But instead of, myself coming in as the lead researcher, we worked with these community members, and they were able to interview almost 150 women about barriers they face in accessing cervical cancer care. So they led the research. We published an 82-page report that came out in January of 2022 during Cervical Cancer Awareness Month. And since then, we've been engaged in, similar to what we're doing in Alabama, a lot of outreach, education, and advocacy around cervical cancer. The barriers are very similar to what we found in Alabama, in rural Georgia, barriers around transportation, lack of information, racism, stigma around sexual health education, lack of access to affordable healthcare coverage. Georgia also has an expanded Medicaid. So the barriers are very similar. But it's been exciting working with a group of community-based researchers and just seeing, how their relationships, the trust, the networks they have in their communities are so important, that they're able to have conversations that, we just don't have because we're not from those communities. We don't have the knowledge. We don't have those relationships. So again, just a plug for investing in communities, engaging them. Communities should be the ones that are leading the research, leading the advocacy, really on the front lines with resources, information to share this information and to ensure that health equity is important, it's happening, it's necessary in their communities. And so we did a year of research, and then the second year was focused on advocacy in Georgia. So we're still working on that, really trying to push for laws that will ensure that everyone has access to information on the HPV vaccine. Again, similar findings to Alabama. Just in our research in Georgia, we interviewed 148 women, and I would say, I think it's a third of them had never heard of the HPV vaccine before. So it's still a huge issue, and it's something that we're hoping we'll be able to address through our outreach and also through advocacy as well. So we have a lot going on. And then the advocacy project that we're doing currently in Alabama, it's also in partnership with the Southern Rural Black Women's Initiative for Economic and Social Justice. And then we're hoping to launch a new project in Mississippi, and that will also be a community-led participatory research project in the Mississippi Delta, hopefully kicking off this year. So that's a lot for me. I will stop there. I'm very happy to answer questions. If there's anything anyone wants to hear more about, very happy to talk more.
Hey, could I ask a quick question? I'm in Sumter County. That's where our university is. Who is your person here? I would love to give them a platform and get them in touch with anybody and everybody I could.
Yeah, her name is Gloria Duff. I'm trying to think of the best way to connect. Can you drop your email into the chat box?
Oh, yes.
Or even a private message, and I'll definitely reach out to you. That's amazing.
And I do a whole bunch of work with, we're trying to develop a community health track within our department, and linking what our program is doing with the larger community and getting involved in things like this. And absolutely would love to meet whoever that is you've got. And my other question was related to the HPV vaccine. And do they do remote clinics? What is that treatment process like? And one of the things that I kind of stumble into here on campus, because of the lack of sexual health education, so much of the resources directed toward high school and younger students. And what I find is we need that care and that education at the college level. And there's gaps in terms of funding and support for programs because our students are kind of past the age, but they need that treatment. And I would love to set up an HPV vaccine clinic right here on campus if I could get one. But I don't know what that process involves.
Yeah, I know they happen. I know that, there are vaccine clinics that I've heard about that are happening. I think maybe your best contact would be through the immunization department at the Alabama Department of Public Health. So I
Gotcha.
can share that contact information. There was an Alabama adolescent vaccination task force that was created a few years ago specifically to increase HPV vaccination rates in Alabama. So I haven't been as plugged in over the past few years to the task force, but that was one of their main goals. So I would definitely reach out to them to see what support they can provide.
Very cool. Thank you so much. Yeah, and if you could get me her Gloria's contact information and any other information, and if there's anything that we can do institutionally to help support what you're doing, would love to be involved.
I'm making sure I copy your email address right now. That sounds great.
So Annerieke, this is like everything that y'all are doing is so amazing. And I had the opportunity to speak with the Alabama group back in December and talk to them about how they can kind of get involved with sex ed work and be advocates for sex ed within the work that they're already doing. And I'm actually speaking, Annerieke, to Mary Davis's group over in Tuskegee tonight, giving like a similar truncated presentation of what I did in December. So she's really excited to have us come and do that. In terms of Russ's question, I know because we're on the Office of Women's Health I guess steering committee. So they have a committee of folks that represent all sorts of agencies across the state, and then they have like consumer representatives, of which I am one. And they have talked about the uptick in HPV vaccines and also in cervical cancer. In like the pap smears and biopsies and all that in the last couple of years. But I know there's a meeting coming up in the next couple of weeks, and I can get some more detailed information and send it out to the folks who are on this webinar. And I see in the chat that Julie Bailey also said that some immunization clinics come to their schools and offer the HPV vaccine. So that's good to know as well. I did have a question, Annerieke. So I think it was the first video, there was the GYN who was interviewed. He's the only GYN in, it looked like he was in Selma.
Yeah.
Is he still there, or is there still someone there to take care of those folks in that county, or is it totally nobody now?
Oh, no. So I haven't been in touch with Dr. Stevens, but there are more gynecologists in Selma.
Okay.
Yeah, so he's not the only one, which is really great news.
Yeah.
And we're actually, as part of our advocacy, trying to track down the exact number of how many gynecologists are now in the Black Belt counties. So like I mentioned, at the time of the research, there were only 4. There are more now, but we need to figure out the exact numbers, which is not easy to do, but we're working on it. So hopefully we'll have an updated number shortly. And
what are the barriers that y'all are coming across and figuring out who they are?
Just trying to figure out, like, in each county, like who they are, where they are, especially because they work in different counties. So we don't know, like, if there's one gynecologist in this county, which other counties they cover. So we're trying to go through local registries. We have the advocates working on it to try and make sure we have an exact number. I know for the the report that came out in 2018, Kelly had to go through painstaking research to find out that number. And actually, we had to revise it because it wasn't right in the beginning. But if anyone has ideas or resources or tools that they think would be helpful, that would be great. And the other thing I didn't mention that you mentioned, and I think it's important to add, so the advocates who are working with us in Alabama, like Christina mentioned, she came to a training that we had in December in Montgomery, and it was amazing for them to hear about strategies around parent engagement, because that's one thing that they're really fired up about, ensuring that parents have the information. If schools aren't going to be providing it, at least we need to make sure that parents have accurate information. And it's, difficult to talk to parents if you don't know them, if you don't have those relationships. So Christina was able to come and give a really great training, a lot of tips and strategies around how to engage parents, how to have those conversations, resources, and tools. So that was really helpful. And thank you again for coming.
Of course. Well, the important thing is to know, based on our research, that the majority of parents do support sex ed, and the majority of parents do want their young people to have access to this information that would certainly prevent cancer. It's totally preventable. A lot of them just don't know about it, or they don't have the confidence to talk about it. Or they think that the school is covering it. And so and they're not in Alabama. And so, the reason I asked about the question about what barriers you're coming across with with finding out who the GYNs are, is because we have barriers in finding out just like even what's taught in most Alabama schools. Mm-hmm. We know anecdotally what we hear, kind of like what you showed in the second video, but we don't have like hard numbers. And that's part of the work that we're going to be doing hopefully this year. But what we know anecdotally is not good. And it is the harmful stereotype, or not stereotypes because they're not true at all, but the harmful messages about being used and, not being good for your future spouse and all those things that are based in a lot of religion. And so, yeah, we're doing the same sort of looking into those things.
Mm-hmm. And yeah, you point to another issue when the state isn't tracking the sexual health curriculum of each school or each district. It's impossible to know what young people are learning, like where they might actually be getting accurate information or helpful information, or where there's no information at all. But without the state monitoring and tracking that, we just don't know. Mm-hmm.
Linda, I just saw your message and I thought I responded to it, but it looks like I responded to the waiting room. I will send you an email because I have your email because you registered. I'll send you an email when we get off of here to give you the information about the talk in Tuskegee this evening. If you can come, I'm sure they would love it. I would love it too. So are there any other questions from folks? We have about 15 minutes left, but we can give you some of your time back if there's not questions.
Well, feel free to reach out. I can drop my information in the chat. I'm happy to talk more, or if anyone has ideas or thoughts. I just saw a question. Do you come and speak to communities? So we have the advocates who are out in the communities, 6 communities in the Black Belt, who are sharing information on cervical cancer prevention. They have tools, resources, infographics, handouts to share. So they're in churches, they're at events like domestic violence rallies, community parties, events, town halls. So we're focused on those 6 communities, but we're happy to join virtual events to share more about the research. If I'm in Alabama, very happy to attend an event. And also I'm sure the advocates, if it's an event that's close by them, would be happy to speak to as well. So if you have ideas or thoughts or anything that would be helpful, we're just really trying to get the message out around cervical cancer prevention, the HPV vaccine, and just making sure more people have access to this life-saving information. So happy to help in any way that is possible. So let me drop my email address into the chat and feel free to reach out.
Yes, and while you're doing that, so there's Anneriek's email. I also want to, it looks like you sent that directly to me.
I'm going to send it to the...
Yeah, that's okay. And Julie, if you want to reach out to us as well, obviously we're not doing like specifically cervical cancer and HPV, although we do include that in our talks about sex ed. But if there's parent events or places where you would like to invite us to come speak with parents, that's also the work that we do. Would be happy to connect with you about that. I did just want to make a plug real quick for our evaluation. I think Megan dropped it earlier in the chat. Megan, if you just drop it one more time. Those evaluations help us get better. They give us topics that you all want to hear about, speakers you want to hear from. So please just take a few moments to fill that out. I promise it won't take more than like 2 or 3 minutes. So with that, I think we're done here. Annerieke, thank you so much. You're always such a pleasure to have as a speaker, and I'm so glad to know you. And thank you for the work that you are doing in Alabama with Human Rights Watch.
So happy to be here, and thank you all for joining. Look forward to staying in touch.
All right. I will be sharing this recording on our website so y'all can access it there if you need to come back for any information or need to share it. Thank you all for being here.
Boy, Christine, I'm telling you, if anything good came from COVID, it's these webinars. I absolutely love that you're doing these, and
I'm glad
every single time they come up.
I'm so glad. I'm so glad to hear that. That's great to hear.
Probably would have been great to have it without a pandemic, but
right. Yeah, if we could have got there without the pandemic, I would have been.
Oh no, but lemonade from lemons. This is
That's
awesome.
great. Thank you so much, Russ. Thank you for those words of encouragement. So we will see you all next month. I think it's on Valentine's Day next month. We're still securing a speaker, but we will have that registration link out to y'all soon. All right. Thanks, everyone.
Thank you.